Victoria Smart, and today I will be performing the skill of assisting a patient ambulating using a gait belt. First things first, this is our patient Ted here. Say hi, Ted. I'm going to verify the provider's orders, and then I'm going to gather all my necessary equipment. So here I have my robe for Mr. Ted to wear. I have my non-skid, non-slip socks to put him in, and then I also obviously have my gait belt. So next I'm going to enter the room, perform my hand hygiene, and then ensure Ted's privacy. I'm going to introduce myself. Hi Ted, how are we doing? To him and his family. And then I am going to explain the procedure that we're going to be doing on Ted today and make sure that I gain consent. I'm going to remove his blankets, and I'm going to lower the bed all the way down to the floor and lower the handrails down that are on the side that I will be standing with him on. Next, I'm going to assist Ted in a sitting position. And I'm going to let him swing and dangle his legs off the side of the bed and just relax there for a little bit while he regains balance, and I'm going to assess him for any dizziness or lightheadedness. Next, I'm going to place the robe on Ted. My robe is a lot smaller. And then after that, I will be applying the non-skid, non-slip socks for him, or slippers if he would prefer. I'm going to assess his dizziness once again, make sure that he is ready to stand, and then I'm going to apply the gait belt to him. So I'm going to put it around him all along the back, and I want to make sure the fit is secure and snug but not being too tight. Then I'm going to grab the gait belt from the sides and back of Ted, and I'm going to have him push off the bed and stand in a standing position. Next, I'm going to assess for any dizziness, any lightheadedness, and if so, I would put him back down on the bed or a chair, which he prefer. And then I'm going to stand, grab the gait belt in the middle of the patient's back, and I'm going to help recognize if there is any lightheadedness. And then also, if he does have a Foley catheter or any urinary drains, I'm going to make sure that those are below the bladder. I'm going to have Ted stand up and take a few steps. And I'm going to make sure that I'm standing on his weak side, whichever is the non-weight-bearing dominant side. I'm going to take a few steps with Ted, assessing for strength and his balance. And then if he does get any dizziness or experience lightheadedness, I'm going to return Ted to the bed or to a chair. I'm going to, if we are in the middle of a hallway or on the floor, I'm going to properly allow Ted to go down to the ground without falling, obviously. I'm going to have him slide down my bent knee for stability and just ease him down to the floor as I call for help or backup. Then I'm going to, if everything goes smoothly after we take our little walk, I'm going to put Ted back to his bed and ease him properly into a comfortable position. I'm going to make sure that all of his personal items are within reach, make sure that the call light is within reach, and that he knows how to use it to call me if he needs anything. And then I'm going to raise back the side rail, so we'll put him back down, cover him back up, and re-raise the side rails. I'm going to dispose of, if I had needed to put any gloves on, dispose of my used equipment, and then leave the patient's room tidy. I'm going to perform my hand hygiene after I have removed my gloves if I was wearing any, And then lastly, I'm going to document and report his response or any unexpected responses that we encountered on our walk.